Good morning, and thank you very much for joining us. I am Yori Folarin. Well, unfortunately, Nigeria has recorded its third case. We were doing good when it was just only the one, but then it went to the second and then the third. And I don't know, we're still doing much, much better than a lot of other countries as we take in the news daily and we're getting briefings from WHO. But we're talking about the coronavirus, by the way. I'm sorry I didn't say that, but it sort of goes without saying. And now there are cries for shutting all our borders. One paper has put it as graphically as that, shut all borders now because of coronavirus. Well, my guest this morning, Dr. Amadili Boyo, public health specialist. Thank you very much, Doctor, for coming on. And we also have Ambassador Ayo Olukoni. Ambassador Olukoni is the Director General of NACIMA, Nigerian Association of Chambers of Commerce, Industry, Mines and Agriculture, and is also the former High Commissioner to Australia. Thank you for coming on, Ambassador.
Thank you very much for the invitation.
Indeed. Now, the cry, shut all our borders now. What are the things, the factors, because what are the factors that need to be taken into consideration before pushing that particular button? Because once the authorities push that button, I imagine it means a lot of things. It's like the panic button. But what, taking into consideration your experience globally in these kind of matters, our own authorities, the president has said we should keep calm. Is that good advice?
Well, thank you very much for that question. I think we can all admit to say that we are indeed passing through a phase in our civilization which is perhaps unprecedented in a way. And the key issue, which of course I'm sure Dr. Boyo will, as a public health expert, will explain to us later. But I think the point is that we should avoid being panicky. We should not panic on this. Because if you panic, we will run the risk of taking wrong decision. It's necessary to stay calm so that we can think properly, look at the various issues, look at the various recommendations which is out there. I just got the notes which was sent out by the Secretary General of the United Nations himself to the UN headquarters in terms of what they want to do, reduce the work situation as far as the UN headquarters in New York itself is concerned, asking people to commute, to work from home, and that created a website in terms of www.un.org/coronavirus to be able to be monitoring the situation. I think such action is what I refer to as something which is quite, not panicky, looking at things strategically and then dealing with it. But I think at the end of the day, the point which we need to emphasize is that this is a global problem. And at the end of the day, multilateral cooperation, international cooperation amongst the entire world is the way to go.
Dr. Boyo, shutting ourselves off from visitors from outside of our community, our country, is that a panic measure? Will that help? It seems logical enough.
Yes, it will help. It will help. And the sooner the better. But the question is, when do we do this? Because we must take into consideration the fact that Nigeria doesn't have a country airline, a national carrier. We depend very much on international carriers, mainly the British and UAE carriers and things like that to go around the world. And we are really not a very high destination for tourists like Kenya and some other countries in the world. Majority of people that come into Nigeria are Nigerians. Most of these countries that have shut down their borders and prevented travels, they also prevent travels from countries with high viral load or countries with high load of coronavirus. And they say, but our citizens and their relatives can still come in. And that's what the problem is. Apart from the Italian that came in, we're now talking about Nigerians from UK and other countries coming in here. If we want to shut the borders, we must face the realization that Nigerians will be the worst hit for it. Two, we are very heavily
Economically, business-wise,
and in terms of movement. People don't come here to go to Obudu Cattle Ranch or to do things in large numbers. We are not a high tourist destination. We are trying to be, but have not yet reached there. Unlike Orlando, Disney Park, all those things, and people don't come here like that. So it's our own people. If you see an aircraft coming to Nigeria, the economic class is basically Nigerians. You have some expatriates coming in. So if we have 500 in a plane, the foreigners will be like 20. Now, banning foreigners from coming here is okay. Banning flights from coming in, it's not a problem. But we have to also calculate the costs implication in terms of the fact that we are heavily import-oriented in this country. Our drugs are mainly manufactured outside. The masks we are talking about come from outside. So many things come from outside. So we advise that borders should be shut. But when? It is, in most countries, they do it strategically. They start from saying all unnecessary travels among Nigerians, even within the country, should be reduced. Social distancing should be enforced. People should not gather more than 50 or 10, depending on the number that the government suggests, together. And then Nigerians should be generally advised not to travel out of the country, and Nigerians abroad should be advised to stay in the country where they are. You go from there, and then you now say, those countries, basically South Korea, Iran, China, Italy, and some European countries are now getting heavily burdened, that we don't want flights from those countries. But remember, like I said, if a flight comes in from Lufthansa, for instance, to Lagos, it's a German airline, and coming from Frankfurt, 80% of people in that flight will be Nigerians who are flying in from America, China, everywhere, using Frankfurt as a hub back to Nigeria. People come from London, they're coming to Nigeria.
This therefore means, correct me if I'm wrong, that to actually, in a knee-jerk sort of a way, close our borders would harm Nigerians' movement more than anything else.
And the movement of drugs and cargo. So the best way to do it is to start gradually by educating the people on the need to stay at home. Start by also telling our relatives abroad, don't bother to come here now. Stay where you are for now. Stay where you are for now. And anybody who comes in, self-isolates 14 days. Don't go anywhere. But you see, the problem with that...
Just tell me the problem with that.
The problem with that is that Nigeria has not reached the level where working from home is a reality. We are basically traders, petty traders. Only about 20%, even 10% of Nigerians work for organizations and earn income. 80% of us are running shops, kiosks, and drivers, conductors, taxi drivers, and things like that. So we're mainly entrepreneurs. When we stay at home, the average Nigerian eats what he makes for the day.
Okay. In addition to what you've just said, and in relation to this Nigerian...
If people had access to the internet and were already working, all those countries they stay at home, they had the option of working from home all along. Most of the cities are completely wired, and they can do that. Now, how will a security man work from home? How will a gate man work from home? How will a bus conductor work from home? You're simply telling him to stay at home. And if he stays at home and all the filling stations are closed down, our electricity supply is not 24/7. It will be shut down, and people will stay at home in darkness. They can't buy fuel, they can't buy diesel, they can't buy kerosene, they can't cook. So you're telling them to die at home, not just stay at home.
This scenario that you paint really is about the panic level.
Yes.
That is if we allow it to get to there. But you were chuckling, Ambassador. Yes. What aspects of all of that? Because I was going to comment that, look, if you say, as he did suggest, that Nigerians abroad, for now, just stay put. I was going to say, well, what of the Nigerian who is saying that, look, this place is becoming so dangerous, this abroad place where I'm at is becoming so dangerous, I think I need to hop back home for now. He's not going to be able to get in.
Let me first say that I think globally there is a reduction in terms of travels across borders now. If you watch televisions in various stations, you will see cities across Italy that are totally empty.
Yes.
Places used to be
the Vatican, for example,
shut down.
Yeah, shut down. So people are listening, and of course, it's an existential reality for everybody. Also, for the airlines, we have airlines that have A380s that have grounded half of the three because people are not flying. So that is one dimension of it which we looked at. And I will also just briefly refer to what we in NASIMA, when the thing was breaking out, the whole question of the economic dimension of it. We had put out a small press statement to the fact that, look, government needs to quickly react to this in terms of reduction of interest rate, to be able to stimulate packages in terms of, that's as far as the economic dimension of it is concerned, because it is quite clear. It's having a serious economic impact. And like Dr. Boyo said, the economic scenario here, how many people work from home and earn a living from that? People must go out. People do go out. But the underlying fact is that the information out there in terms of reduction of social interaction, in terms of question of general state of cleanliness, and that's why I'm quite delighted with what CDC is doing. You can see that our Minister of Health is practically every day on television to give us an update. The Lagos state government is also there. I saw this morning Governor Sanwo-Olu himself went to the airport. So this awareness in terms of being very, very careful is key and very important.
Is there, sorry, I wanted to, for interrupting you, but I understand that experts are also concerned, and it's what you said about Lagos state officials, the governor and all of that, are sometimes concerned about the political dimension of this. That is to say, not necessarily sharing information or admitting the how dire a situation is in their domain.
I had said earlier, and I made reference to what the United Nations said, that this year, the UN is 75 this year, and they were talking about the question and issues of the world we want, the United Nations which we need. Implicitly, an organization like the United Nations is key and very important in this day. Look at the WHO. I think every hour there is a briefing in terms, because it is not just one country. It is the entire world. You can even say the entire human race, global pandemic, and that's the very, very important part of it. And China, where it started, haven't been able to, with a combination of science and public policy, been able to contain these things, is now ready to share information in terms of, this is what we found out, this is what we are doing. This is key and very important. As we take national action on our own, we should also reach out. If you remember, the Director General of the CDC went to China as the thing was going, to go and listen, to go and learn. And when he came, he decided to quarantine himself for 14 days.
He self-isolated.
So this is the approach as far as this is concerned. International cooperation is very important, and the heart of that, as far as global public health is concerned, the #1 organization is the WHO. And so we need to watch, we need to closely see what lessons we can learn in terms of taking a decision on our part as a nation.
Dr. Boyo, we are hearing from experts that sometimes the symptoms of coronavirus might be so mild that experts believe there are people actually walking around who actually have the virus but don't know it. The authorities don't even know that they need to be quarantined. Certainly they themselves don't need to know, they themselves don't even know that they need to be quarantined. The worry then would be these people with these low symptoms, but that if they knew and if they were tested, would indeed indicate that they have the virus. Can they still transmit? Because can they still transmit the disease? Because this is the scary aspect of this whole thing.
Yes, maybe I will start from where we stopped the other time, which is what do people do? Like we said, people should be made to understand not to panic. And I still insist the government should not just shut the borders today. We should go stepwise. Let people know you don't have to travel. If you don't have a need to travel, like medical emergencies, stay in the country. If you're abroad, stay where you are right now. And then we can move on later to say flights from the following countries will not come to Nigeria, with the mind that we are going to affect Nigerians mainly, whether we like it or not. Now, with the other lady that came the other day was a Nigerian from the UK, and then she had coronavirus. So we are going to shut all these things down. We should be done with discussion.
By the way, that lady was she just was using information out there, and herself decided to self-isolate.
Yes,
and then when the symptoms developed, she now called the authorities. Now that showed that this is a person who just knows what's going on, who has information.
Yeah, but all churches, mosques, and people are already getting to know about this information. So what we are talking about now is that they are now what you call the asymptomatic carriers. People that don't even have any symptoms at all.
Okay.
but it can still spread the disease. So there's so many ways of looking at this, from suppression to mitigation. Now the
How
question-
worrying is what you've just referred to as
Oh, very, very
asymptomatic?
very,
They
worrying.
don't feel ill themselves.
Yes, I'm coming there briefly. They're very, very worrying. The first aspect of it there is that in Nigeria, we don't even go to hospitals. Yeah? When you are sick, you don't go to hospitals. You first of all self-medicate. You now go to the chemist down the street. You ask a local doctor in the compound. When it's bad, after
The
2
chemist
days,
or
not
the pharmacy?
better. No, chemist.
Or you go to the
You
pharmacy.
go to the
Pharmacy.
pharmacy, yes. Yeah. After 2
And
days,
in some cases, even the pastors can be of help.
yes. After 2 or 3 days, if you're not
Pastors,
better,
pray for me.
if you're not better after 2 days, consult your doctor. That's
Yeah.
what they say.
Yes.
Even on adverts. Now, so what am I saying here? And that's a key thing here. The coronavirus, the symptoms resemble to look at here as malaria. What is there? Fever. All is there? Running nose, catarrh, cough. These are symptoms that we also associate with malaria. And that's why we're going to be in a very, very difficult situation, because the Europeans and Americans, the Caucasians, take fever very seriously. In rising temperature, they have gone to the hospital. You will not go to the hospital today if you have a fever. You will likely take an analgesic and sleep it off. Or
Let's just watch it.
let's just watch it till tomorrow morning. But they do that.
And then, as you said rightly, you don't go to the hospital. You go to the chemist and say, look, where is that? And Nigerians know so many
Yeah,
brands
they
of
call
drugs.
the drugs and they give them to you. And after 3 days, you drink it with Gary or some other thing. You say, I'm better now. Or Iyalagbo is also there. Don't forget that. Dongoyaro is also there. So people don't go to the hospital. The hospital sees what the public health physicians call the tip of the iceberg. In every disease, even normal, not even an endemic, not even pandemic, normal diseases, only the tip of the iceberg eventually go to the hospital. Now I'm talking in Lagos State, 60% of the people use private hospitals. Then some people use the public hospital, large people use public hospitals. But what will make you go to a private hospital or even a general hospital? I told a woman yesterday in my hospital, I'm referring you to a teaching hospital. She said, God forbid, my case never reached that. You can imagine that.
It's not my portion.
It's not my portion. God forbid.
not my portion.
I won't go there.
I will not have a teaching hospital matter.
I will try to die here. It's not my portion. So there's that thing there. So let me come back to what you're saying. Fever to the Nigerian is not a strange phenomenon. We now need to be educating Nigerians on 37.5 degrees. If you have a temperature, how many Nigerians have a thermometer? In Europe and America, a thermometer is part of a household. People tell themselves their temperature. We don't know that here. We touch ourselves and say, oh,
It's a bit
it could
warm.
be the sun. Maybe because I didn't take breakfast.
I think you need. When
Or
I
my
go to-
enemies are after me.
When I go to the market, I'll get the
I'll get
agbo. I'll get the
I'll
agbo
take
for you.
alabuku.
I don't.
So at the
I
end
don't
of
like
the day,
this.
it is this similarity between when these symptoms, initial symptoms start of malaria and what we call flu, but people can call it typhoid or things like that, that Nigerians will have to be careful about and say, anybody who has a temperature, call. Don't self-medicate, call. If you have a temperature, you have had contact with anybody who traveled to the country, or you have just entered the country, or you have had contact with anybody who is from those areas we call Europe, South Korea, China, please, immediately
Let me
call.
stay on this temperature thing, doctor, for a second.
Yeah.
The correct, the normal temperature of the human body is one thing. You said where should we begin to be worried when it goes beyond 37.5?
Normal temperature can be anywhere between 36 and 37,
Okay.
But when we get to 37.2, 37.5, you begin to know that you have a fever. So if somebody has 37.1, we have what you call the core temperature and the auxiliary temperature. You can put a thermometer under your tongue, you can put a thermometer under your armpit, or you can, when in children, put it right into the anus. There are many ways of taking temperature. But the body temperature, when it's above 37 degrees, like 37.5, 37.2, can begin to get worried. But that's not enough. Have you had contact with anybody who had a coronavirus, who had just traveled to the country, or who, by any chance, even maybe a Nigerian, but flew in recently, or works in the healthcare sector with coronavirus? Remember, in America and in Europe, healthcare workers are dying now.
Okay. So again, staying a bit just for 1 second on
Yeah.
the temperature business.
Yeah.
Are you suggesting, doctor, that if you got a 37 or slightly above temperature,
Yeah.
even if you're feeling good,
Yeah.
you need to alert the authorities.
Alert, not authorities, alert
Your doctor.
your doctor.
Your
first.
doctor.
Because you may.
That's on the one
no,
hand.
because, and also, don't forget what I said, have you been in contact
Yes.
with anybody who traveled into the country recently? Or have been in contact with anybody who have been suspected to have had coronavirus?
Fine.
It is those two things that make you, there's a difference between a suspect, you know.
I don't know if you want to address it
And
now
the
because
contact.
I'm leading directly from what you have just said. We are hearing from doctors that there are now cases that have not had anything to do with people who have traveled from anywhere,
Yeah,
but
community infection, yes.
yes, community infections.
Yeah, yeah.
So I just remember that as you were speaking,
yeah,
that you needn't have been in contact with anybody, and there have been recorded cases of such
Yeah,
transmission.
but people get more worried in Europe and America because malaria is rare there.
Oh, okay.
Here, the temperature in Nigeria is a friend of the home. Everybody knows what I mean. That is a familiar thing. So it's this over familiarity we are worried about. In Europe and America, temperature, even if you have malaria, you can be quarantined.
Yes.
In Europe,
Yes.
that you have malaria is a big issue.
Simply yes.
In Nigeria here, you just go across the counter
It's
and buy
regular.
drugs that you can't buy in Togo and Benin Republic without prescription.
Yes, Ambassador.
I think we also need to look at the dimension. I mean, Dr. Boy was really giving us a very, very interesting and very informative explanation in terms of that. I think we need to also look at what role our CDC, and especially which I think is the heart in terms of
Centers for
Control
Disease
Center.
Control.
yes,
The
a control center, public health crisis like this. Relatively, you can say our CDC is new on the scene in terms of our own history. And I think they need more support in terms of what exactly. The last time, I think it was the Lassa fever thing, which of course brought them into the picture. Now they're also on the forefront in terms of this.
And the Ebola thing.
Yes, and the Ebola thing too as well. And so the question and issues of the link between our population and the CDC in terms of reporting information, we need to look at how we can scale up that so that people can quickly say, look, listen, this is what I've observed as far as this is concerned. That's one area. And then also the respective states. Our states, I think we need to rethink how we can get the respective state, especially the public health, the Ministry of Health in the respective state. How prepared are they? How prepared are they? Because sometimes we seem to just revolve around Lagos, maybe Abuja, 36 states.
Ogun State.
And then maybe Ogun
because
State,
of the proximity to
a
Lagos,
whole
they're sharing
range of states
information,
across
sharing.
I think this is one of the things which I think to deal with this crisis, we need to start thinking seriously in terms of how the respective states themselves can capacitate themselves and also tap into the whole question and issues of education for the population, sensitization. Because, I mean, if you go to a place like, maybe I don't know what state I want to mention, just off the cuff, maybe to Makurdi, or maybe you go to a place like, maybe visit on nature or something, or go to the market in terms of what amount of sensitization is on. I mean, on our part, like I said, in the Nigerian Chambers of Commerce, health is wealth. We're looking at it also from the perspective of the economic dimension of it, and also sensitizing our members in terms of maybe in the workplaces, how to sensitize your members in terms of education, as far as this is concerned.
Yeah.
So these are the various dimensions.
You mentioned an interesting thing. A number of offices, they started out when this news first broke with what was the hand sanitizer thing.
Sanitizer.
But now the shelves have been cleared. I just wish you luck if you go out to the market and say you want to buy, a pocket-sized sanitizer, or I don't know, whatever size sanitizer. I noticed that places that used to do that, for some reason, I didn't bother to ask, the practice has stopped in some of those places. They used to give you a drop. Now, because there's been this panic buying and people have bought out everywhere, the other point that I think is of interest is that, again, experts abroad are saying that clearing out the stock with all this panic buying of stuff that maybe it's not the best sort of a thing. They said, look, the masks are not particularly of benefit to ordinary people walking the streets. They're meant for professionals. Leave them there for professionals. And then, can you go back to what you have both mentioned? Basic hygiene,
Yeah.
soap and water. Wash your hands for 20 seconds or so. And I've even heard that the hand sanitizers, are not the most beneficial all of the time. Maybe do you want to speak to this, doctor?
It's still about social distancing must never be overlooked.
Yes.
Preventing the gathering of more than 10, 20 persons,
That's going to
which
be
of
tough.
course is virtually
That's going to be tough.
it's virtually impossible.
We must go to church on Sunday. We must go to the mosque on
What about the
Fridays.
market
We
place?
must
What
go
about our bus
to
stops?
Babalagbaja and Somoluruko Kotoma Debe.
What about our bus stops, our bus stops, our markets? And
Yes,
we don't have
yes,
malls.
yes.
We don't
There
have
are all
malls
sorts of
as such
social
in
events,
Nigeria. We
naming
all have-
ceremonies, weddings.
so-
What will Lagos be on a Saturday without the dotted events all over the place?
But then we pray it doesn't get to that level, but it's going to get there. It's like preparing for the worst, expecting the best, or expecting the best and preparing for the worst. I don't know which of the two to take.
Yeah.
Now. But you see, social distancing must constantly be talked about in the marketplace and everywhere. Constantly be talked about because it's one of the key.
And it goes against the grain because
Yeah.
humans,
But
we
you
are
see, there's no
social.
point-
We are social
You see,
by
people,
nature.
People are ready to criticize the government for not shutting the borders, but they don't want to accept social distancing.
Aha.
You see, there's no point. We must start from the basics. Start from the ABC. Social distancing. Keep 5 feet away from somebody, which is a stretch of like 2 hands, 2 hand stretches. Keep. Who wants to do that? We still hug. We still shake hands. And then, well, we should be emphasizing that, and then emphasizing washing of the hands with water and with soap. But where is the water? Where is the water? We don't have. We always talk as if there's public water supply in this country. People don't have water to waste like that.
I hear what you're saying, doctor.
Yes.
But
So at the end of the
maybe
day-
the word waste won't come into play
To
now
to
because
use.
people see that this is about life.
Let me
It's
tell you,
as
let me
good
tell you.
as
You
water for
live,
drinking.
you live in Lagos and maybe at Lekki or Ikoyi. But you see, the average Nigerian will go to the well, fetch water from the well, and in some compounds, the landlord will give you water and you pay 5 naira, 10 naira, 20 naira a bucket of water to take your bath and to cook. Now, you want to now wash your hand. There's average home in Lagos does not have a tap. You get a bucket, you get a bowl, and you wash your hands. You get a bucket, you get a bowl, and wash. So we should always
this
be
picture
very
you're painting.
pragmatic and know that this is
picture you're
what
painting, doctor. That,
we
the
all
average
don't
house in
live
Lagos
at
doesn't have a
Lekki.
tap.
We all don't live at Lekki. We don't have. Don't you, Nasima? What do you
Yeah,
think?
no,
We don't-
Okay.
you're quite right, sir,
let-
in terms of, because the question
I
and
hear you,
issue,
doctor.
quickly, the question and
listen,
issue of,
Doctor, I'm sorry, Ambassador.
Wash
I've got
it.
to go on a break now.
Okay.
I'll come back so we can continue this without any further interruptions
too
from me.
scared.
With every house in Lagos not having a tap. Stay with us. We'll be right back. Okay, welcome back. We have Ambassador Ayolukoni and Dr. Amadili Boyo in studio, and the conversation has come back to coronavirus. It hasn't actually gone away. And so, and we started off from the whole notion of closing our borders and how much that would help, and we've been looking at what the factors are in taking such a decision. Indeed, I think so far you've said that, yes, you can understand it, but it's a matter of when should we get to that stage. And it's all about reducing as much as possible contact between infected people and non-infected people. But so much that government itself has said that for the time being, even officials, no more foreign travel for officials. But we made the point also that doctors have begun to tell us about community-based infections that have had nothing to do with anybody from abroad. But the point we made before going off to a break was the matter about, at the end of the day, the bedrock of all of this is going to be personal hygiene. And doctors have said, all sorts of specialists have said that you've got to wash your hands with soap and water as many times as is reasonable as possible for, I think the duration is, you recommend about 20 seconds at least, even if you're not going to be able to scrub up like a surgeon. But go ahead and do what you do normally for 20 seconds. Let's now come to, in terms of personal hygiene within ourselves, within our borders, all sorts of places people go to, public places. I don't know, as you said, apart from the 5-star hotels, the 7-star hotels, I don't know whether there are running taps In fact, I should rephrase that. I do know that the running taps don't exist in a lot of public places, and that's a problem.
And that's why what we were saying initially, wash your hands. And we said, don't just wash
But
your
you
hands
can't do that.
by putting on the
Yes.
water.
With soap.
No, use the soap like this. You go like this. You wash your hand like this. Then you come back and do like this. You go back and do like this. Then you wash the fingers. You do your thumb. You do your thumb. It's a whole process that we are putting up online.
And we just got free consultation there because that's
yeah.
a surgeon speaking.
Yeah.
It's a surgeon
So
speaking.
at the end
So
of the day-
the way they scrub up, what you just described is
No,
elementary
all
level.
medical officers know how to scrub. All medical officers know how to scrub.
And they are taught how to do
And they are
that.
taught how to scrub. Now, we're now saying that people should learn not to scrub now, but to wash their hands thoroughly with
Okay.
water and soap.
Yeah.
And the simple thing is to go through the process.
How much,
Go through
how,
the
mu- how much,
process.
how much water do you need to do an efficient job?
The
Because
simple thing that we don't need much water. The problem here is due to the fact that we waste a lot of things. We don't have to open the tap to the maximum level to do that. It's just let the water drop minimally, and you can continue washing
and
your
where
hands.
you said there are no taps, what would be the next device? He puts it in. That is why I asked the question of how much water is really necessary for a person who doesn't have any, because you're going to have to soap up as you just recommended and then rinse off.
Yeah.
How much water do you think is necessary?
Yes, the first thing is that there are many ways you can organize these things locally. You can have a plastic bucket, you can have an iron bucket, and you can put a tap under the bucket and pour water into the bucket and then open the tap to wash your hands. But the easiest one is to get a bowl of water, a bucket of water, and have a plastic bowl, and then get somebody to pour the water on your hands.
Yes. Okay. So
You can
okay.
get somebody to pour the
Okay.
water on your hands.
So
And you can do that.
So you can probably could you do a good job in something like let me see now is a beer bottle two beer bottles will be something like 1.5 liters.
Yes.
Yes. Two beer bottles will be something like.
No, one big table water is 1.5 liters.
There you go. Do you need that to do an efficient job? Half of that.
Half of that, really.
Half of that
really.
could
It's
do
not
a
how
good
much
job.
is poured on your hand. It's how much time you allow the soap and the water
okay.
to soak your hands.
Okay.
And then you eventually
and you
wash
just
your
said
hands
that
clean.
doctors recommend 20 seconds that you keep on soaping
Yes,
and rubbing your hands.
But I think on the social media we've seen very many of these. I mean, this demonstrated several times. So much so that the DG of the WHO himself
Yes.
also
There's something
demonstrated
like
this
WhatsApp.
in terms of which is underscoring the fact that look, listen, this aspect of washing hands properly with soap is key and very important. And like you said, that maybe we may not have running taps, like Dr. Boyo said. I mean, let us make efforts to have water in bowls, I
Yes.
mean in pills,
Yes.
and then we have a plastic.
In addition
And
to
don't just wash because you want to eat. You know, we wash
We-
our hands because
when
we want to eat.
Yes.
But wash our hands now.
Every
when you
time.
greet people,
Anytime.
when you want to go out, when you come in, you wash your hands.
many
Yes.
times as
You
possible.
enter a
and
building,
then
you
wash
try
your
to
hands.
do that and all
we
of
see
that.
most of this, the coronavirus can exist on railings and things like that for like 8
Yes.
hours.
There you
So
go.
when you go in a public
Yes.
place, avoid
Avoid
holding
doing
railings
railings.
and avoid touching things because and then when you touch things, avoid touching your eyes and your face.
There you go. Mr. Abati in Agege, good morning, sir.
Yeah, good morning to you, sir.
Thank you for calling in.
And good morning to your guest.
Yes, thank you.
I want to make a contribution.
Go ahead, we'd like you to.
Yeah, I want to call for more synergy in the fight against this pandemic, especially between the government side and the private medical practitioners. The synergy is not yet known.
What example do you
Especially-
have to illustrate that?
The synergy I'm talking about is that it appears that the private medical practitioners, they are not yet involved in this fight. And we thank God, this index case is just minor. We have not been overwhelmed with very many of them. But what I'm thinking is that the private medical practitioners cover a very large area of our medical services. At least up to 60% of the patients, they visit the private medical practitioner. And these private medical practitioners, they are well organized. Organized in the sense that they are divided into zones. You have Agege Alimosho zone, you have the Ifako zone, you have Etiosa zone, all that. And they all have secretariats. I am thinking that the government should think of the way of using the center, the secretariat, as a testing place where suspected cases in private medical services could be sent to and do the test, just like we do the HIV test and all other things.
Okay.
We know this one is novel, but all the same, we should think along that line, because if you have many cases like we have in Italy, government alone cannot handle it. So the private medical practitioner can be involved in this detection and all those things.
All right.
Because it's not an easy thing. It's a very difficult something to detect.
Thank you very much for calling in, Mr. Batty. Really appreciate your call. As we were saying, government is taking this very, very, very seriously. Is it your understanding that what Mr. Batty is suggesting has already been taken on board?
Yes. In fact, kudos to the Lagos State government. All private, I'm a primary care physician. I have a private hospital, so I work in Lagos, also in the private health sector. And I can say it in good authority that the Lagos State government has had trainings for all medical doctors and all medical directors. And in fact, the WHO, the Center for Disease Control, has partnered. And in fact, it's as if that's what we do every day now, going from one meeting or the other. The Lagos State chairman of the Association of Private and General Medical Practitioners is virtually at the control center with the commissioner every day. And there's a WhatsApp group. Every private hospital is aware of what the state government is doing, and the state government is carrying the private hospital along and ensuring that there are sanitizers. If you enter a private hospital now, your temperature will likely be checked. Mm-hmm. You'll be given hand sanitizers to clean your hands with. And the Lagos State Supervisory Board for Private Hospital has gone round these hospitals to make sure that corrective measures are put in place and shut down some private hospitals as well. So all private hospitals have self-corrected and self-evaluated themselves, and the Lagos State government is on top. In fact, there is the state conference of the general and private medical practitioners we're on now, and the whole essence is also to prevent this spread.
Okay. Ambassador, you were saying that we shouldn't fall into the trap of leaning or concentrating too much on Lagos and perhaps Ogun. You said across the country, you're wondering how well prepared and organized we are. We've heard from Dr. Boyo how, at least speaking for Lagos, he operates from Lagos, southwest of the country, where we're talking from. That's your concern.
I think the beauty of
as
it,
far afield as Nasarawa and all those other places.
I think the beauty of it is that, like Dr. Boyo said, that we have the Nigerian Medical Association too. There's also other medical, the other day I was watching the Guild of Medical, Medical Directors, in which one of our colleagues from IFE, Dr. Babala, was also. I think all these structures should be used. Like you said, we should, as much as possible, countrywide, using many of these structures. The CDC itself can, of course, reach out to most of these places. We have branches of Nigerian Medical Association all across the country. Every state of the North. And then in the respective states, you also reach out to the crannies and nooks and crannies across the respective states.
Even to the chemists and the pharmacists. And
it is very important. And also today, now we do have radio stations and community radio stations all over the place too as well. And then we can also, this institution can also go on and see most of these stations themselves as partners in progress, so that there will be public enlightenment using the respective stations all over the place.
And then social media.
And then social media too as well.
Okay,
yes.
1 second please. Comrade Igwe in Umuahia. Good morning, sir.
Yes, good morning. Hello, good morning.
We can hear you, comrade.
Yes, comrade speaking. Can I go ahead?
Yes, please.
Okay. I just want to contribute to the discussion going on.
Sure. Go ahead, please.
Thank you. Yes. So far, I do not think that the state, apart from Lagos State, I do not think other states are really prepared for prepared ahead of, in case this, because so far we have about 3 cases at the moment.
Comrade, is it just a feeling you have, or do you have what they refer to as, is it empirical evidence for making such an assertion?
Yes, okay. You know when the issue of Port Harcourt came up, the University of Port Harcourt Teaching Hospital. Hello, I can't hear you well.
No, please continue. We can hear you clearly.
Okay, thank you. I said when the Port Harcourt's own case came up that somebody reported herself, we were listening. The University of Port Harcourt Teaching Hospital said they don't have the test kit. The Enugu own case came up as well. Do you know that the same Enugu don't have test kit? So if Enugu, that is presumed like the capital of the Southeast, Port Harcourt, a whole University of Port Harcourt Teaching Hospital does not have a test kit. And the person speaking on TV said it openly. It is a disgrace. That while countries are trying to see how they can curtail this, states, apart from Lagos, don't have a test kit.
Okay.
So they don't have test kit. Then how did they come to the conclusion, especially the Port Harcourt case, that the lady who came to submit herself is negative? So what I'm trying to say is that we should be prepared. Like the speaker said there, ordinary wash our hands. Most schools today don't even have this basic hygiene washing hands in front of their schools. So I want to appeal. We should take this thing serious. We should not wait until it becomes until it gets into the country in full force.
All right then.
So why should University of Port Harcourt, a whole University of Teaching Hospital, then Enugu don't have this kit?
Thank you very much, Comrade Igwe.
Coronavirus.
Thank you very much for calling in. This matter of supplies possibly running out. I don't know. You heard him. He referred to test kits. What's your understanding about shortage or otherwise of test kits?
The point is that it's a universal problem. This is a pandemic, and the production of test kits, even it's WHO that has been able to mobilize some test kits and send to Nigeria. We don't produce the test kits here. You know, even the Ebola vaccine, Ebola test kits, these things are not things that you pick from the shelves. In America, if you remember, Donald Trump said you can get yourself tested, and it turned out that it wasn't possible in America. Even as I speak to you now, if you are suspected of corona in America, you won't get your result in 48 hours.
Wow.
You won't get your result in 48 hours because the test kits are not enough. They're not even available in some parts of America.
So it's a global challenge.
Yeah, global challenge.
Yeah.
Then two, in Nigeria, they don't see us as high priority. Don't forget that. We're the ones that are talking like this. We have 3 tested cases, and after the 3, 2 of them have not even gone into ICU or respiratory failure.
In fact, the very first case we understand is likely to be discharged soon.
So there are so many factors to shift test kits to Europe and America and other places, and then keep some here, because they know that if everybody decides to go for test kits today, the whole world will now have the test kits.
Okay. Mazi Okoroafo in Aruchukwu, good morning, sir.
Good morning, Sayori. Good morning, our guests in the studio.
Sure.
Thank you, sir.
Honestly speaking, Sayori, gentlemen, let us share ourselves. You see, State Ministry of Health are not doing the needful. Honestly speaking, look at what is happening in our motor parks. Look at what is happening in schools. No sanitization, nobody, no nothing, even in the communities. And we are taking things for granted. Come down to the east, they will tell the heat is very, very hot. That the heat weather in the east will kill a virus of coronavirus. As I will tell you, then you just go and balance in the evening and take a gogoro, take pepper soup, everything, magana, go and take St. Leaves. You see, it's a very serious problem because our population, we are too many. And upon that, the people concerned, nobody's doing anything. We are just waiting, everybody's waiting for when it's please, authority concerned. There is no place, all the places you see that is there is no pipeline water. Schools don't have all those things. And we are just sitting there looking at, look at what the American people are doing. Look at what other countries are doing. We are seeing what is happening in television. Nobody cares, even what you show us on TV every day.
Okay.
People are not doing anything.
All right.
Please, authority concerned, there is need for us to be what? Proactive right now.
All right.
Honestly speaking, I don't know what is happening because this one is no longer, we agree, prayers will save us. Yes, prayer, banding and casting will save us. But it is that we have to do the needful.
Okay.
Thank you very much. Have a blessed day in Lagos.
Thank you, thank you, Mazi. Doctor, let me just get one point. This matter about the tropical temperature in our locale here.
Yeah.
Tell me how relevant that is, because people are saying it can't survive as well as in damp, cold areas.
Yeah, they are correct in a way, but that does not mean, like we normally say, the most vulnerable people, whether it's in Africa or Europe, is still the elderly above 60. They are
And the very
people
young.
with pre-existing condition. In other words, diabetics, hypertensives, HIV, AIDS, people that have not just carriers but have the disease itself, and so many other diseases that we have. More people will die from malaria this year than coronavirus. More people will die from cancer of the breast this year than from coronavirus. More people will die from hunger and poverty this year than from coronavirus. That's clear. But the point is, there's a pandemic coming, and we are being proactive. I know what they said about the motor parks. People that are saying we should shut down the country. Let's get people to go to the motor parks and take temperatures and
sensitize.
sanitize. The little they can do and do talks in churches, talks at the motor parks and things like that. Then beyond that is that let people know that ordinary fever is no longer malaria or typhoid. That's what I mean.
So shutting all our borders is probably not the first recourse, is the point I think I have heard. Ambassador?
Yes, I mean, I think that's key. That's very important. Somebody traveled, a friend of mine traveled recently from the US and went to Qatar and showed me the picture of the business class. It was empty. A business class that takes close to about 50 people, only 3 people are there. That's an indication of the fact that across the world itself, there's this dimension to it, which is very key and very
Okay,
important.
let me get it from Mr. Akpan in China. Good morning, Mr. Akpan. Akpan, you are based in China?
My goodness. That's what I'm saying. I'm not using Wi-Fi.
Please go ahead. Go ahead.
Right. I just switch it off.
What can you tell us?
Switch it off.
Are you safe yourself in China? What can you tell us about the situation? Hello, Mr. Akpan, we can hear you.
Okay. Well, we thank God here in Beijing, we have no problem again. It's only those people that are coming into China are the one bringing back the problem. So that's the main problem we are facing in China here. And I also want to greet my Oga there, Ambassador Nukoni. So our problem in Nigeria is going to be behavioral problem. Because here in China, they comply with the rules. If government said remain at home, they remain at home. But I think in Nigeria, that is the main problem we will face. Not abiding with the rule. And the government, I read from the television and the bans on flight. That is okay. But government also should try and create testing and other medical facilities for those people coming into Nigeria so that they can curtail it. And I listened to the ambassador who said that they have to do sensitization, and that will help us a lot. That is what is helping China here. They have to do some sensitization, and the people will listen to, and they abide with the rules. So that is what I want to contribute. Nigeria should have to be sensitized. Yes. Thank you very much. My regards to my ambassador, Olukani.
Thank you.
Thank you, sir.
Thank you very much. In fact, I don't know. Well, sorry about that. I was just trying. It's a bit unprofessional. I was trying to get hold of a message that I understand is being. But you can see what is being scrolled there. Apparently, government has taken some action. Well, what is that action? Can you speak into my ear? What action has government taken? Okay, I understand. As you can probably see scrolling, we in studio cannot see it, but government, I understand, has restricted entry from 13 countries,
yeah.
you know, 13 high-risk countries. It is being scrolled as we are speaking. But because we are in studio, we can't see that. So action is being taken, but as you were saying, and as the president has said, authorities have said, we need to be calm, not panic. And Dr. Boyo has actually said, whereas he doesn't have anything against restricting entry into Nigeria, it's a matter of when do we press that particular button. Well, I don't know. Did you want to add?
Yes,
Because we
just once those buttons are pressed, they start a chain of reactions. Whether we like it or not, we must ensure that people don't panic. Even if the reality calls for us to take more measures, take measures without getting people to panic, because panic leads to irrational thinking and behavior.
And we can't afford
fear,
that.
Yes.
I totally agree with that. I mean, it's quite interesting that the person from China was saying hello to Ambassador. Most likely, maybe one of our staff in the mission and others in there. I mean, but the question and issue, which is the issue of sensitization, and what also Dr. Boyes has said, and we should also take it to the nooks and crannies of our country. Don't let us listen,
and really listen to government, to our officials, our experts,
And
the
let
broadcast.
state governments wake up.
wake up.
Local
Yes,
governments
yes,
wake up.
yes.
Traditional rulers wake up.
Okay.
Yeah.
So, well, I want to thank you very much, Ambassador Ayolukoni and Dr. Amadeli Boyo. Thank you, gentlemen,
Thank you very much.
for sharing your perspectives with us.
And all the very best to the entire human race.
Indeed.
As we face this crisis.
As we continue to do the right thing and remain prayerful.
Thank you very
We
much.
must add that as Nigerians. So that's our program. Please join us tomorrow for a fresh edition. I am Yori Volare. Bye-bye for now.